Welcome to the graduating class, to family, friends, faculty, staff, and everyone joining us today. This is a wonderful time. We've gathered to celebrate you, the graduate, to acknowledge the tremendous amount of work and support that's been required to get you to this place. And it's been in a time, a year that we will not forget anytime soon. So much has happened in the world, so much has happened in your lives. This day is meaningful and it's special as you've powered through a tough year with extraordinary resilience, persistence, and excellence. And what a wonderful achievement to have you graduate in the time of a pandemic. Did you think you'd hear someone say that? It's great to be graduating in the time of a pandemic. Well, I think it's exciting that you're entering the field of public health at a time of both crisis and at a time of change. In a year where we've experienced, unfortunately, a lot of loss, but we've also had an abundance of joyful things going on as we've seen the efforts that public health officers all across this world have made to help us get through this tough time. And we've been able to manage through both of those extremes in our lives. I hope you've also felt the energy of us setting up a new school. The Herbert Wertheim School of Public Health had its first full academic year after being approved by the Regents, and we've been trying to set the standard for a 21st century School of Public Health, really setting the tone. Of course, we're no exception. We're a microcosm of what's going on across the nation. However, here at this school, we're preparing for you. We're preparing a space where you hopefully felt welcome, where the next generation of individuals who come to train in this school will feel welcome, and where they will grow to understand some of the things that hopefully became clear to you over the last year or two that you've been training. So let me just say a few things that hit me that I thought would be things that you picked up along the way. So being in a pandemic, it exposed us to a lot of things. It exposed us to the underinvestments that we've seen in public health. Those of you who've had a chance to take our Foundations of Public Health course, you hear us say all the time that when public health is going well, nobody notices us, right? So it's a discipline that attracts people who are comfortable sitting in the backdrop. And when public health often gets a lot of national or international attention, it's because something's gone wrong. And in 2020, something went wrong, right? We experienced pandemic SARS-CoV-2. We weren't able to keep it at an epidemic proportion and then hopefully mitigate it and control it. It went into the pandemic space. And we saw that our health system couldn't absorb the need that was raised by the pandemic. So there were not enough medicines, there were not enough hospital beds in some areas and regions of the world. There was no vaccine. We couldn't withstand the burden that COVID was placing on our system. It also said, look, the things that public health practitioners talk about all the time about prevention and the need to address pre-existing conditions was also in the forefront of our minds as public health scientists and trainees. We understood, how important it became for people to have solid health status, because in the face of comorbidities, people were likely to do worse throughout the pandemic. We also saw a conversation unfold around the equitable distribution of resources, something that we train you all around. Do all neighborhoods have access to the basic things that we need to thrive? And we in public health often have that conversation about how to improve our access for all neighborhoods. And we saw throughout this pandemic how that bore a disproportionate burden across various neighborhoods. And then the social determinants of health and whether or not people have social safety net, social services that address poverty, address childhood hunger, are again things that we saw playing out that were conversations we had in our classrooms. Really importantly, and I think under discussed, was the healthcare system that we work in. And right now in America, 95% of the people in this country are in a decentralized third-party payer system that largely doesn't see public health as a part of its responsibility. And we had to use this uncoordinated system to secure personal protective equipment, or PPE. We had to use it to teach nurses and physicians how to recognize and treat COVID-19, a really underappreciated central problem that made us stutter coming out of the gates as we tried to address this issue. And I would be remiss if I didn't bring up the fact that those of us working in public health know all too well that structural racism is a public health crisis. Racism has caused many problems that are health related to be worsened in communities that are Black, Indigenous, and other communities of color. During COVID, we saw that in certain communities, workers didn't have paid time off and so kept working when they experienced symptoms of COVID-19, sometimes spreading and transmitting inadvertently because of the inadequate access to information around how this virus was moving. Essential workers kept working, and no transportation to get vaccines when we came to a place where we saw that we had a vaccine available. Some of our neighborhoods hardest hit in the pandemic will also be most vulnerable to many of the public health challenges if we do not address structural racism. But we now have a growing group, thanks to you and your training in public health, who will emerge as our new leaders, our new heroines and heroes at many levels, our cities within our states, within our world, to allow us to have equity and justice across this country. We also, in order to manage through COVID, needed to engage our communities and work with our communities in decision-making around how we were going to communicate, and thinking about, once we had a vaccine, how we were going to get people interested in the vaccines. We can't establish trust overnight, and we needed to meet communities where they were and try to develop partnerships that I quite honestly hope will be long-term, far beyond COVID, that will help us to manage through some of the things that we still have to do, the work that you all are going to be doing as newly minted public health professionals. I also want to say that we are hoping that you will realize that you didn't just come to a place for a year or 2 or 4. I hope you've noticed that you're now a part of a community, a large community. You have some really excellent trailblazers who have come before you. I just want to, at the risk of leaving anyone out, just bring to your attention that right here in San Diego County, our Chief Public Health Officer, who received a co-award as the Person of the Year for 2020 in our region, Dr. Wilma Wooten, is a Triton, trained right here at the University of California, San Diego. So you have some amazing trailblazers ahead of you, and I look forward to seeing where your careers are going to go as well. I want you to know that we care deeply about what you'll be doing next, and I hope that you'll join this community of scholars with some universal truths around things that are important in public health, and that you'll share your talent and your treasure with the people of this community, and you'll let us know how you're doing. Before you leave, we have secured for you a set of tributes, and these tributes are given by individuals who are luminaries in public health, who wanted to say to you, congratulations, and give you some words of wisdom before you move on. So at this time, I want to introduce 3 individuals whose videos you will see shortly, who will be sharing with you their best advice. So first is Dr. Sonia Angel. Dr. Angel was a scholar in the Robert Wood Johnson Clinical Scholars Program. She's also a prior Peace Corps volunteer in Nepal and received a medical degree from the University of California, San Francisco, and completed a residency at the Brigham and Women's Hospital in Boston University. She also has training in tropical medicine and hygiene from the London School of Tropical Medicine and Hygiene and a Master of Public Health from the University of Michigan. She's currently a practicing physician at the New York Presbyterian Hospital and at the Columbia University College of Medicine. She, in prior roles, served as Deputy Commissioner of the New York City Department of Health and Mental Hygiene. She oversaw the Division of Prevention and Primary Care, and her group was largely responsible for why we no longer have trans fats in our food system. She also served as a senior advisor for global non-communicable diseases at the U.S. Centers for Disease Control and Prevention, has been an independent consultant to the Pan American Health Organization, and was also the director of the California Department of Public Health. So Dr. Angel will have some words for you shortly. We also have some wisdom coming from Dr. George Rutherford. So Dr. Rutherford is one of the most interesting public health practitioners that I've come across in my career. He had undergraduate training in both chemistry and the classics from Stanford University. He also did a master's degree from Stanford in history, and then went on to Duke Medical School and trained as a pediatrician. He now is working in the areas of epidemiology and prevention of infections and tropical diseases that are of public health importance, both internationally and domestically. And his primary focus has been on HIV and AIDS. However, here in the state of California, he was really at the vanguard of how we approached our SARS-CoV-2 and COVID-19 pandemic. The work of Dr. Rutherford largely influenced how we did contact tracing here in our region, and how we were able to pivot and move forward in a coordinated way across the state, relying very heavily on the work that he did early in the pandemic, so that we could move the state of California toward meeting the milestones for SARS-CoV-2 and COVID-19 mitigation. So we are extremely fortunate to have him share his words of wisdom with you. We also have wisdom coming from Dr. Sylvia Trent Adams. Dr. Trent Adams is currently the Senior Vice President and Chief Strategy Officer at the University of North Texas Health Science Center in Fort Worth, Texas. She has a really interesting background. She was a nurse officer in the Army, received her Bachelor of Science in Nursing from Hampton University, a Master of Science in Nursing and Health Policy from the University of Maryland, Baltimore, and her PhD from the University of Maryland, Baltimore County. She served as Deputy Surgeon General as a Rear Admiral in the Public Health Service, and supported the Surgeon General regarding operations for the Commission Corps, communicating the best available scientific information to advance the health of the nation. She's held other positions at Health and Human Services, and has worked to improve access to care for poor and underserved communities. So at this time, we will share with you their words for you.
Congratulations, Herbert Wertheim School of Public Health and Human Longevity Science graduating class of 2021. You made it, and not a second too soon, because we need you more than ever. It's no secret that for years our public health systems have been and underinvested in. And as we emerge from a global pandemic, also with a heightened awareness of systemic racism, the case has never been more clearly made. We can't afford to continue this way. And this is why we need you. The experience of COVID-19 demands that we fortify our community's defenses against the threat of future pandemics. We have to invest in our public health systems to rapidly detect, contain, and eliminate infectious threats. We need you to help lead that charge. But if we don't also address persistent, well-documented health inequities, we will continue to be vulnerable to the next pandemic. Martin Luther King said, "Injustice anywhere is a threat to justice everywhere." That's true when it comes to health, and it's certainly true as we struggle to emerge from this pandemic. COVID-19's disproportional impact on communities of color and low-income people made it clear that equity and building community resilience everywhere is also pandemic planning. Reducing the burden of chronic diseases, caring about mental health, creating a sense of well-being, safety, belonging, and confidence in our systems is also an essential part of public health. And taking on climate change, that also needs to be a part of public health. We need your fresh eyes, we need your energy and your passion to ensure that we emerge with a public health system that protects everyone, everywhere. One that's strong and dynamic and capable of meeting the challenges of novel viruses while tackling threats that take an enormous toll on our health every day, like cardiovascular disease, cancer, diabetes, lung diseases, injuries, substance use. But to realize that vision, we need to reimagine our field. And for that, we need your technical skills anchored in the latest scientific thinking. We need you to ask tough questions and find answers. We need you for program implementation and policy development. We need you listening to communities and their stories, understanding their perspectives, and helping to design health solutions that reflect their priorities. Public health is not a field one chooses for personal gain. It's not glamorous, and it's often invisible. Public health is about hard work, science, and collaboration. And it's also about making the world a better place for thousands and even millions of people at a time. So as you emerge with your degree in hand, ready to bring your passion for public health with you, please know that you can have an enormous impact. The skills you have are exquisitely matched to the need, and that's an amazing position to be in. Welcome to our public health community. We are so proud of you, and we need you now.
Hi, first of all, let me congratulate all of you on completing your degrees and more importantly, for choosing such an excellent profession as public health. These past 18 months have been an utter bear in our profession, from the emergence of the novel coronavirus in Wuhan, China in December 2019, through wave on wave on wave of carnage in China, in Europe, in India, in South America, and in the United States, where 600,000 of our fellow citizens have perished. We have seen the appearance of a new generation of vaccines and their rapid deployment, and we've seen their effect on reducing the incidence of disease, at least in wealthier countries. We should be proud of California, where thoughtful management of the epidemic has kept our mortality rate well below the national median. In fact, if other states had fared as well as California, there would have been 125,000 fewer deaths nationwide. If other states had fared as well as San Diego County, there would have been 215,000 deaths nationwide. And if other states had fared as well as San Francisco County, where I work, there would have been 390,000 fewer deaths nationwide. Clearly, the suite of mitigations that we've designed and deployed, everything from social distancing and mask wearing through to vaccine promotion, well, possibly not the lottery, but we'll see about that, have had a profound effect here. We, however, cannot neglect the challenges that remain. We need to lead the vaccinations of the rest of the world, starting in Baja California. We need to redesign and redeploy our pandemic infrastructure that was dismantled during the last administration. And we need to recognize that threats from nature are as real as threats from foreign powers and criminal cartels. That will be your job, along with dealing with everything else we need to deal with in public health. But first, to continue the proud tradition of public health in this state, the most prosperous and diverse in the nation, and a beacon for the rest of the world. Good luck and Godspeed.
Hello, I'm Dr. Sylvia Trent Adams, and I am so honored to have the opportunity to say congratulations to the Herbert Wertham School of Public Health class of 2021. I am incredibly proud of all you have accomplished to get to this day. You have overcome many obstacles in the midst of the COVID-19 pandemic, as well as social and political unrest. But today, we celebrate your hard work and commitment. Graduation symbolizes the closing of one chapter and the beginning of new opportunities. First, I want to acknowledge what you have done. Each year, many people start academic programs, but not everyone finishes. You hung in there and you made the necessary sacrifices to complete your studies. You've demonstrated that you have grit. Through your coursework, your tests, labs, papers, research, presentations, and so much more. You've demonstrated the dedication to your mission, the mission of becoming a competent public health leader. No matter how hard things got, you made it through. There were probably a few days when you wanted to quit, but you didn't. What you have accomplished is no small feat. It is incredibly a huge victory, one to be celebrated. Never forget the reason you entered your field of study. Remain passionate about public health and serving others. Getting to this point from where you started the first day of your program took a lot of work and courage. And as you go forward, I hope that you will be an innovator. Your career doesn't have to follow a traditional path or the same paradigm that has always existed. I challenge you to chart your own course, pushing the boundaries to explore new territories for public health. Initially, you may not find that place where it all fits together, but learn as much as you can wherever you are. Until you define your own success, my advice, lead from where you are. Everything you learn along the way will prepare you for the next level in your career. And I would also recommend to find joy in all that you do. Over the course of your career, don't forget the excitement that you feel today and how happy you are to reach this milestone. That passion will take you through the peaks and valleys of your career. And as you go forward, take your place at the table wherever you are. It may be in the community, in the lab, the boardroom, research, policy, or elected office. Take your place and own your space. You are the future of public health, and I know you will lead with the same dedication that has brought you this far. We are depending on you to make the world a better place. I wish you much success and Godspeed. Thank you.
Graduates, what a fantastic set of advice. Like, I wish we were together right now, and I wish those speakers were with us, because I could just hear the place erupting in applause. Truer words have never been spoken, and we are so fortunate to have had them share those with you today. So at this point in the morning, I'd like to say thank you to our organizing team for this amazing event. Thank you to our staff, Dina Rogers, Alyssa Crossman, Maddie Noble, Cha Esquera, Rosemary Sabala, and to our program directors, Drs. McMenamin, Pratt, and Trinidad. All that you do is appreciated, and I know that our students are applauding you right now for all that you've invested in them over the years. Students, there are links in the chat with directions for your next event. So please do take a look at those so that you can get to the next spot with your families efficiently and effectively. My closing words to you are this. Keep in mind that you are our future leaders, and the world is hungry for the gifts that you can uniquely offer. I hope that you'll continue to cultivate the internal ingredients that are going to allow you to do meaningful work and to innovate. I hope that you'll embrace the future, embrace the strong history and traditions of public health, and also think about what is necessary for us to be successful in the future in this field. I personally believe that love is the greatest power on earth. So know that we love you. We're here to support and encourage you as you join this community that's united around a common vision, a common purpose, and collective resilience. Don't let the enormity of the public health challenges that we're facing overwhelm you. Take it one day at a time, one moment at a time, and realize that in order to solve these challenges, it will take all of us in everything that we do every day. Have humility and have peace during the challenges. Every day is a chance to write a new chapter, and I hope that you will own the pen. Take what you've learned, put it to good use, and as you head into the next chapter, may you have the courage to love and to give with an open heart. Congratulations, everyone.